Oh, so are LPN/LVNs nurses? Dun, 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 dun. Come back, let's talk about this. So the question of the day of the episode is, are LPN LVNs, are they nurses? Is an LPN or an LVN a nurse? The answer is yes, yes, and yes. Did you hear the answer? The answer is yes, yes, yes. And if you don't know, please let me school you, okay? Now, to become an LPN or an LVN. And the reason why I keep putting the two of them together on the East Coast, and I believe in some parts of the Midwest, it's called LPN. And then on the West Coast and part of the Southwest, I think it's called LVN, which stands for Licensed Vocational Nurses, and LPN stands for Licensed Practical Nurses. Now, the question of the day is, are they nurses? Yes, an emphatic yes, yes, yes. Now, LPN school is anywhere from 10 months to 15 months. And usually when they're done with that, they are going to do the NCLEX for LPNs, for PNs, practical nurses, okay? I don't know how it is in the West. Is it VN? Anyway, but they have their own NCLEX, okay? As long as you're doing an NCLEX exam, you are a nurse. I don't care if it's PN, RN, ZN, TN, CNN, MSNBC, I don't care, okay? CNN, NNN. If you're doing an NCLEX, meaning you have been determined to have gone through a recognized program, and now you're going to be licensed by the Board of Nursing to become a nurse. You need to understand that. Once you've gone through that process, you are a nurse. Period. So for those doubting Thomases out there, or those ne'er-do-wells, or those jealous people or haters out there who think LPNs and LVNs are not nurses, they are. Okay? Please get schooled. Let somebody tell you, and I'm telling you right now, I'm not somebody, I'm telling you, they are nurses. Now, for the CNAs who have a problem with it, and I did do a video about this, and I'll put it up so you can refer to it. If you as a CNA do not regard, or do not respect, or do not accept that LPN/LVNs are nurses, well, I can tell you right now, you're a hater. You are a hater, you're bitter, and you're jaded, and you're disillusioned, and you're sad. Why? Because you probably tried LPN, LVN school, and it's either you didn't pass, or you didn't finish, or you could not even start. Don't be hating. Okay, your time will come, and you also will be regarded as a nurse. Now, for those CNAs who, for whatever reason, they live under a stone or they live under a rock and they don't really know what the different duties are, let me go ahead and tell you. But before I do that, let me explain to you why I'm going hard like this. And again, I explained in that video before I did this. It was something about why don't CNAs, LPN versus CNA, what is the difference? Let's go ahead and talk about it today. And I was like, why don't they respect them? The duties are so different, okay? In a lot of nursing homes, you find nursing homes are run by LPNs, not CNAs. They are nurses. They interface with the doctors, with the lab, with pharmacy, with family members, with all kind of interdisciplinary healthcare staff. CNAs don't. Okay? You don't. What you do essentially is help and assist with activities of daily living, which is what? Brushing hair, brushing teeth, helping to dress, helping to feed, helping to assist to walk, ambulate, or transfer with the wheelchair. And again, what people don't like to say all the time, wiping butts. Essentially, those are your duties. You as a CNA or a state tested CNA, those are your duties. That's what you do. You don't give medication. Now let's talk about what the nurses do, just so that for those who are kind of confused, who think that they also are LPNs or they're LVNs, because those two LPN LVNs are not nurses. Please let me school you. This is what, or these are the duties of what LPNs and LVNs do, so they're actually nurses. They do treatments. So what are treatments? Treatments are things termed outside of medication. You have treatments on the skin, which it can be wound. Okay. You have people who have a trach. That's a treatment. People who cannot feed by mouth and they feed through their nose, or they feed through their stomach. Okay, you have people who have draining wounds, meaning they have to be like a machine attached to their skin that drains those fluid from the wounds. LPNs, LVNs do this. Okay, they also make assessments. Like when there's a fall. Do you remember that when there's a fall? Yeah. You as the CNA, you don't touch the patient. You actually call that LVN, or you call the LPN to come make an assessment, and they get in touch with the doctor and they fill out that fall packet. Remember that? Yes. That's what the LVN and the LPN does. Who does that? Yes, the nurse. And who are these nurses? LPNs/LVNs. Okay. You, the CNA, you don't do it. So you need to stop hating. Okay, are LPN, LVN nurses? Yes, they are. Sir, they are. Ma'am, they are. A lot of you do not know. Now, I understand a layman not knowing because they don't, but a CNA actually putting down or disregarding an LPN/LVN, you're a hater. That's all. I'm just going to call you out. You're hating because maybe you failed. You couldn't make LPN school. You couldn't make LVN school. And so you're just going to hate, because that's what haters do. Those who fail, trying to achieve something and they couldn't do it, they're going to hate on others that actually did succeed in doing it. It's either that or you're just evil. Again, you have those out there. It's either that or you don't feel good about yourself. Again, which comes back to you just hating. You actually hate your life. That's the only reason why CNA, who works in a facility, who works in even home health, who works with, even if you're a sitter in somebody's house, okay, with a patient, you have your duties. Your duties does not entail giving medication. You need to understand that. Now, if you're doing it, it's because you're doing it under the table. If you get caught, you get caught. Now, some CNAs have been trained to do that, but your job essentially is to remind them to take their medication. Now, if you've been trained as a CMA, I'm so glad I brought this up. A CMA, a certified medication, some people say CMT, tech, or certified medication aid, is not a nurse. All they can do is pass meds. They cannot do treatment. They cannot make assessment. They cannot interface with the doctors. They cannot interface with the pharmacist. They cannot document like a nurse. They cannot make assessments. They cannot do interventions. Those are all the things that LPNs and LVNs do. They make observations, they do interventions, they make assessments, okay? And then they in turn relate it to the doctor. They're able to read the labs. They're able to actually interpret some diagnostic words, and graph. They're able to also, signs and symptoms of certain ailments. They know all that. LPNs and LVNs do. And actually, I will tell you this, the more experienced they are, because there are those LPNs and LVNs that either age or finance or whatever it is, they did not go on to become RNs, that know even more than doctors. Okay, a doctor that just got off medical school today is not an expert. He also has to grow, and they're usually trained by nurses by way of, it could be an LPN, LVN, it doesn't matter where you are. The only thing is they've not gone through medical school. So people need to be very respectful of people's titles, okay? When a doctor, who is at the pinnacle of healthcare, and that's why I'm going to that. When a doctor comes into a facility or comes into a home and he sees your title, CNA, GNA, STNA, or whatever it is, he's going to be very hesitant to talk to you. And even when he does talk to you, he dumps it down because you're not skilled, okay? And then when he's talking to a nurse, he sees an LPN, he's like, okay, yeah, you've been trained. And this is what they will do, okay? So are LPN, LVN nurses? Yes, they are. I would even tell you this. I remember that the exam between LPN and LVN and NCLEX is really not that different, if at all different, okay? However, is the number of years you spent in school, and they're sending add-ons, okay? Because again, certain states practice differently, okay? There's certain things LPNs are allowed to do in a certain state and they're not allowed to do in the neighboring state. That's just the way it is. Those are just state things. However, you cannot take away from them, from LPNs and LVNs, and think that they're not nurses. They are nurses. So for those laymen, people not in the field who don't understand the different titles, LPN and LVN are nurses. They do nursing duties. By and large, they actually run the nursing facilities. It's filled with LPNs, okay? Nurses run the long-term care facilities, okay? You might have a DON who's probably an RN, but I've also known of places where an LPN is the DON of a nursing home. In assisted living, they're all run by LPNs. The DON is an LPN. Okay, so let's just stop this foolishness, especially for those CNAs who should know better. You should know better. Stop hating. You're just hating. There's no need for that, okay? There's plenty of room. Go to school, become a nurse, become an LPN, LVN. Then you can talk. So if you got value in today's episode, please give me a thumbs up, hit the notification bell, and subscribe if you haven't. It's free. Pass my video around, okay? Share it. And I'll see you in my next video.